Yes, so apologies. So the UK position then is that more than 2 women die every day in the United Kingdom from cervical cancer, and our incidence of cervical cancer is relatively high. So it's 9.4 per 100,000, though in London it is lower. But as you heard from Jean-Luc, our incidence is higher than the French. And to eliminate cervical cancer, it needs ideally to be less than 4 per 100,000. So the graphs are really illustrating the median, which is in young women in about 35, as the most common age at which cervical cancer happens in the United Kingdom. And the lower graph is illustrating the inequalities in healthcare and showing that those that are most deprived have a much higher rate, both incidence and deaths from cervical cancer. So our program started in 1988, and we had call and recall since then. In 2020, we moved to primary HPV screening, except in Northern Ireland. And I, with all of the kerfuffle with my slides, forgot to mention that the United Kingdom comprises 4 countries. So we have England, Wales, Scotland, Northern Ireland. And with respect to colposcopy, the Republic of Ireland, all of the colposcopists are also trained and accredited through our British Society. So across the United Kingdom, we invite women between the ages of 25 and 65. Other than in Scotland and Wales, that is now doing it every 5 years, in England and in Northern Ireland, we still invite women between the ages of 25 and 49 every 3 years, and women aged 50 and over every 5 years. And what I'm showing you here is that for the latest figures that we have, which are to 2018, there were just under 3,200 cases of cervical cancer. So we have been successful within our program in the sense that it is now the 19th most common cancer in the United Kingdom, though it remains the 2nd most common cancer in young women. So that's under the age of 44. And is responsible for about 1% of all female cancer deaths. Mortality from or deaths from cervical cancer are relatively low, though clearly for a preventable disease, we would prefer it to be significantly lower or non-existent. But it has been stable for many years at 850 cases per year. But as I mentioned to begin with, that is still more than 2 women every day dying from a preventable disease. And the biggest risk factor for cervical cancer in across our countries is not being screened. And one of the worrying things from our program is that year on year, coverage for cervical screening has been decreasing. And the maps of England show you that the dark blue is predominantly good, and the light blue and the grey is poor. And what you can see in the slide there is that for London, the vast majority of London has coverage of less than 70%. And indeed, for the country, for 2022, coverage was only 68.7%. So essentially, 1/3 of eligible women are not attending for their cervical screening. And that is a concern when one is thinking about eliminating a preventable disease. What this illustrates is that coverage remains good in the older generation. So in the generation that is used to attending for their screen, in the 50 to 64-year-olds, that although it's decreased, it has remained under that above that 70% threshold. But at all other age groups, it is decreasing and under that threshold. So in terms of thinking about strategies to eliminate cervical cancer, Jean-Luc talked about the WHO initiative to eliminate it by 2030. our National Health Service put out a document and a strategy in November of 2023, and the aim is to eliminate cervical cancer across our 4 nations by 2040. And there are 3 pillars to that approach. So there's vaccination, which clearly is key, and the evidence from Scotland shows that in a vaccinated cohort, the incidence of high-grade disease is dropping dramatically. So we vaccinate both girls and boys. Since September last year, it has been a single-dose program. We have a catch-up program, which is available to young people via their general practitioner, and we have aims to make it available in libraries and pharmacies and community services and online bookings. Screen coverage, I've already mentioned, is a huge issue, and there are some ongoing studies to look at the place of self-sampling to see if that helps to encourage women to attend. And there are various programs looking at tackling the inequalities and providing information specifically in minority groups and so on, as I've outlined there. And then clearly equally important is when one does screen, that if there are abnormalities, that we have a workforce ready and able to offer appropriate treatment for these women. And for us, for 2022-23, we performed 246,762 colposcopies, and that number has been increasing, particularly since the change to primary HPV testing. With respect to vaccination, the program was doing very well, and we had coverage of 80-odd to 90% until COVID, and the numbers have not recovered as yet. So these graphs are showing coverage for boys and girls after a single dose across the years, and on average, 76% of girls and 71% of boys have had their vaccine. And these are some of the other strategies that we are working with. So Joe's Cervical Cancer Trust is a charity that provides information and support for women with cervical abnormalities and cancer. And they have a coalition roadmap which is looking at various aspects, including leadership, education, looking at the workforce and the digital platforms that we need to be coordinated across the countries. And to summarize, our aims are to increase the vaccination rates to 90%, to halt the decline in the cervical screening and increase the screen rate to at least 70%, to ensure that 90% of women that have an abnormality get treated. And those philosophies and plans have been laid out in a range of documents for us, including our NHS long-term plan, our women's health strategy for England, and we have a women's health ambassador in Dame Professor Leslie Regan, who's the first ambassador for the country to improve women's health, reducing healthcare inequalities, as I've mentioned, and the roadmap. So with that, I do apologize that you haven't seen the full presentation. I'm not quite certain what happened there, but I look forward to any questions. Thank you.